October 8th, the World Health Organization validated India as having eliminated trachoma as a leading cause of blindness in the country and around the world. While the validation was a long time coming and highlighted the convergent success of many endeavors around India, it also ironically served the purpose of reminding that the country still remains what has often been described as the blind capital of the world. One institution that has been at the forefront of repairing vision impairment and restoring sight to tens of millions of Indians for over 4 decades now is Venu Eye Hospital based in New Delhi. Founded in 1980 by a remarkably passionate and professionally successful ophthalmologist, the late Dr. Rajendra Seth, Venu has treated over 8.5 million people, a vast majority of them free of charge, in line with its founding philosophy. It now runs 5 eye hospitals. By the time Dr. Seth passed away in 1996 at age 56, Venu's mission had firmly been institutionalized. Nearly 3 decades later, furthering that mission is his successor and managing director of the Venu Eye Hospital, Tanuja Joshi. As India addresses its widespread problem of blindness, most of which is caused by the poor with cataract unable to access treatment, Tanuja says Venu keeps its focus on expanding access to the economically weaker Indians. She spoke to MCR from New Delhi.
Welcome to Mayank Chhaya Reports. Tanuja, it's a great pleasure to have you.
Thank you. Thank you for inviting me.
I want to start with something rather positive. I read that the World Health Organization has just validated that India no longer has trachoma as a major cause
Yes,
of
yes.
blindness. Tell me a bit about it and whether Venu, being an eye institute, what kind of role or perspective you have on that.
So, India had been saying that we don't have trachoma, but some years ago there was some sporadic cases that were reported. In fact, Venu was part of the 2005-6 rapid assessment that the government did on trachoma, and but we're very happy to say, that finally WHO has accepted, because there was a lot of campaigning done by the Indian authorities to say that we really don't have trachoma anymore, and there had been some very very sporadic case, but we are glad that now finally WHO has accepted that India doesn't have it's eliminated.
Right.
So it's actually a very interesting day today, because it was only today that it came in the news.
Indeed, indeed. Trachoma is an interesting problem in the sense that it has things like poverty, hygiene, and other things feeding into it.
Yes,
Especially in the Indian context, India has been a sitting duck for any number of
yes,
reasons for that. So it is
yes.
especially remarkable that we no longer have it.
Absolutely, absolutely, because poverty is still there. Those issues, health issues, are still there. But I think something like polio, we have had a success story, and
Right.
it's interesting to see that this also has been successful as a campaign.
Yeah. I think
In fact,
people don't. Yeah, sorry, go ahead.
no, in fact, India, when it was the first country to launch one of the blindness schemes in 1976, the National Program for Control of Blindness, and the initial effort of that scheme was for trachoma control. And so that part, we've done very well.
Right. People don't realize that it's a bacterial problem. It starts with that something that could be pretty quickly prevented or avoided
Absolutely,
altogether. And then it builds
absolutely,
up and finally it's irreversible, right?
absolutely. And it's also, it spreads. It spreads with touch. It spreads with hygiene issues, and so definitely we are very happy that at least that part we have been able to manage.
Right. To broaden our conversation a bit, India is home to 17% of the global population and accounts for 25% of the world's blind population.
Right.
That's an
Absolutely.
astonishing statistic in
Absolutely.
itself. How do
Absolutely.
you, as a major institute and hospital, look at something like that?
See, the problem is definitely lack of access. definitely awareness plays a part, but most of the healthcare facilities in India are in the urban areas. Now, of course, it's also going into the smaller towns, but most of the disparity of the population, majority being in the rural areas, and the services being in the urban areas, is one of the issues. And also, a majority of the blindness is due to cataract,
Right.
which is age related. And so the elderly and the children are the vulnerable segment. And in the rural areas, the elderly are not anyway given importance. So the problem is that so what the government, the three-tier network that the government has with the referral centers or the teaching hospitals, with the district hospitals, the secondary level, and the primary health centers it's a beautiful scheme. It's a beautiful, the program. But unfortunately, in the government setup, in the rural areas, there are lack of resources, whether it's doctors, whether it's the medicine. So Venu has adopted a similar approach, that we have our main teaching and referral hospital in Delhi, and at the second level we have our 30-bed rural hospitals, which we call our satellite hospitals, and what we call the PHCs, we have our vision centers and camps. So
Right.
we have adopted a similar model. In fact, most of the eye care organization in India follow that. And now, see, when Dr. Seth started this in 1980, it wasn't such a structured thing. In those days, it was either the government hospital or trust hospitals. And